Welcome, everyone. My name is Susan Allan, and I am thrilled to have you with us today because today is a very, very unique event. Many of you don't know that it is thanks to Dr. Rhonda Donahue that every single one of Marcy Preble and Peter No's 15,000 distributors know about Lifewave. I know about Lifewave because of Rhonda. Every one of us can say how blessed we are that Rhonda researched and researched and researched and found out about the Lifewave patches. And of course, thanks to Marcy Preble and to Peter for telling everybody. So it is that kind of a wonderful symbiotic relationship. And of course, we're also grateful to David Schmidt for inventing the Lifewave patches. So I'm Susan Allan, and welcome to all of you, and welcome Dr. Rhonda Donahue, who is the founder of Ageless Health in Southern California, and who is going to tell us so much about the Lifewave patches today. And I guarantee you're going to learn things you never knew before. So welcome, Rhonda.
Thank you, Susan. It's great to be here.
Now, we're going to start today with a topic that is really important and that a lot of people that I've spoken to, a lot of people in my downline, knew nothing about when it came to Lifewave patches. And that is transforming anxiety and depression. So Rhonda, please tell us about that.
Okay, well, first I would like to say that anything we discuss here today is not meant to diagnose, treat, or prevent any disease or illness. We always recommend that you consult your doctor before trying any of these patches or any other protocol that you are thinking of using. We are sharing real life and health situations with real people. So if you hear anything today that resonates with you and would like to try these patches, you have free choice to do so. So with that, let's get started talking about the causes of anxiety, depression, and PTSD. There are so many causes of these three issues, and there are very serious concerns when it comes to our overall well-being. In fact, a recent statistic reveals that 17.6 million adults are estimated to have what's called major depression disorder, which includes any and all of these three issues we're talking about. And that's not even talking about the high rates with children today. I tried to find a statistic, and I haven't gotten a most recent one, but I'm sure it's high. So let's first talk about anxiety and depression, as they go hand in hand in most cases. Anxiety is something everybody experiences at times in their lives, and long-term chronic anxiety can lead to depression. So depression is a serious disorder, and it can really be difficult to overcome. Many people are diagnosed with clinical depression and are put on medications to balance the serotonin levels in the brain. But now we can use Lifewave patches to help give people a natural alternative without the unwanted side effects. So some of the many causes of anxiety, depression, and PTSD are worry, fear, trauma, death of a loved one, divorce, moving, changing jobs, losing or not being able to get a job, as well as other major changes in one's life, like physical changes, environmental changes, and of course, world events. And then we have PTSD, or post-traumatic stress disorder, which we have seen many military veterans suffering for many years. And this is caused from the difficulty of a person to recover from a terrifying event. This condition can last months or years, and with triggers that can bring back memories of a trauma, which causes intense emotional and physical reactions. PTSD is usually treated with medications as well, and professional consulting, and also changing certain lifestyle habits can help. But all three of these, anxiety, depression, and PTSD, are stress related and can also cause cognitive difficulties. So your brain can get stuck in danger mode, which elevates inflammation and hyperactivity in the brain. And this can lead to mental illness if not properly taken care of. And this is where the patches have helped many people with these conditions. It brings down that inflammation and hyperactivity in the brain, allowing the emotional and chemical stress to be reduced in the body. And then the body can work towards rebalancing.
And, for me, this is such a crucial thing because in 1994, I was diagnosed with PTSD. And I've been successfully treated. Any of you who've watched me, on the show for 2.5 years, obviously that I'm functional and that life is pretty good. And the patches have made a gigantic difference. I was already using adrenal support. I was already using non-medication support supplements, but the Nirvana patches have made a huge difference. And I work with clients all over the world, and a lot of them have this problem. And the difference is huge. So if this is a problem that you've been dealing with or someone you care about has been dealing with, this is one of the rare shows where I will have a transcript available for you of what Rhonda is saying. Because God bless you, Dr. Rhonda, she sent me her answers yesterday. She took the time to write them. So I have the answers, and of course I have my questions. So if this or any of the other topics Dr. Rhonda is going to discuss today are important to you, just send me an email. And it's the YouTube channel, and you've probably been there many times before. And so it's susan@susanallan.org, and that's ALLAN. And I'll quickly send you the transcript. Okay, thank you. Now let's see the second question. We're talking about Lynn, and she's about 64. And Rhonda, you helped her amazingly with chronic depression. Would you tell us about that?
Yes. When I first met Lynn, she told me that she was having severe anxiety and depression, which had been going on since she lost her son about 5 years ago. And this is one of the hardest tragedies for parents to go through. And she found herself not getting out of bed for weeks, not going outside the house in months. She was even taking medications that just weren't working. And she had no joy and no motivation in her life. And so she decided to try the patches. And we started her on X39 on the back of the neck at C7, and the Nirvana system, the Nirvana patch at mid-chest heart level, and 2 Nirvana supplements per day. 3 days later, she texted me and said that she was feeling better. And 2 weeks later, she called me and said she was feeling hope and joy again, and actually getting out of bed, showering, and going outside in her yard. And then after 4 weeks, she was feeling like a new person. And her husband was seeing the difference in her, and he was so happy to get his wife back. And it's now been about 9 months. And when I see her, she tells me the patches changed her life. And she is so grateful. And I just love hearing that.
Thank you. It's such a joy. And how many clients have I had who told me they were on medications and the medications weren't working? And I'm specifically referring to anxiety, depression, and PTSD. I actually had to say to a client last month, I had to say to her, your medications aren't working. And she said, what do you mean? I said, well, you're taking medications for anxiety, and you just told me what happened the last couple of days. You're taking medication for mood swings, and you just told me the thoughts you've been having since we spoke the last time. Clearly, that's not an example of medications working and managing mood swings. I mean, it's horrifying, and that's why I'm laughing. I'm certainly not laughing because it's funny. She didn't realize and she's a very intelligent, competent person with a PhD, though not a doctor, she didn't realize that there was a way to get healthy, that there was a way to use Lifewave patches and change your brain chemistry, and change your life in a safe, effective way. And that is why I'm so thrilled to have Dr. Rhonda Donahue with us today. And now you're going to speak about Sherry, who's about 78 years old, Rhonda?
Yes, Sherry, she's been a long-time patient of mine, about 7-8 years, and she's one of those wonderful patients that takes my recommendations and goes home and actually does them. And she's learned over the past 6 years to really take care of herself and is always willing to make the necessary changes. And 2 years ago, she decided she wanted to get off her depression medications after being on them for almost 15 years. And I knew we needed to work gradually with her because she had been on meds so long. So we started her on the X39 on the back of the neck at C7 and Eon just below the belly button for the first 3 months. And she also had severe psoriasis for many years and was on medication for that as well. But we weren't sure if she would ever get off of that. But after 3 months, she noticed less anxiety, less pain. Her skin didn't itch as much. And then we added Alavida at night under the belly button and Nirvana during the day with the patch mid chest heart level and 2 supplement tablets daily. So then after 6 months, she got both, she went to her doctor, regular doctor, and got both of her depression and psoriasis medications cut in half. So that was pretty significant. And then after 6 more months, her doctor took her off the depression meds completely. And then another 3 months took her off the psoriasis meds and just put her on a cream, which she uses today. And 2 years later, she's so happy and healthy, and her skin is cleared up, and she really looks younger for her age. And she's so happy. It's just so rewarding to see someone have those changes in their life, because it's really, really wonderful. So.
Thank you so much. That's truly glorious. And even for people who don't want to take pills, there are a lot of people in this day and age, they've taken millions of pills in their life, they don't want to. So I actually use 2 Nirvana patches sometimes, depending on how I feel, So I'll put one in near the underarm position. I'll put the other either right below my neck, or if I'm going out and I'm wearing a sweater or a top, I don't want the patch to show, I'll put it into the other position, which is lower. And the positioning is all shown in those little booklets that come with it. And most of the patches, many of the patches, and the ones that Rhonda is going to describe right now, you can use anywhere. So if you would, Dr. Rhonda, please describe the X39, which is the primary patch, and also the Eon for us. Thank you so much.
Okay, so I'll start.
Just 1 second. Stephen, would you make sure that you mute yourself, please? And anyone who isn't muted, would you please be sure to mute yourself right now? Thank you.
Okay, so I'll start with the X39. So we all, hope to age gracefully so we can, enjoy our later years full of energy and vitality and good health, right? But so often with age, our bodies start to show signs that things just aren't like they used to be. And we don't repair from injury, for example, like we used to as a teenager. So what's going on? As we're aging, we lose a lot of things, and we lose stem cells. In fact, at age 35, we have lost 50% of our stem cell activity. And by age 65, we have lost almost all of our stem cell activity. And stem cells are the only cells in our body that can turn into any other kind of cell as needed. And they're really responsible for repair of all of our organs and tissues. And so the X39 stem cell activation patch is made of organic acid crystals. And when applied to your skin, they're activated by the body's heat, which is a form of infrared light. And then the patch reflects a light wave back into the skin that stimulates the skin and elevates these naturally occurring GHK copper peptides, which are actually have a lot of health benefits in themselves, but they're also proven to activate your own stem cells naturally in your body, and also helps produce more stem cells and resets your stem cells to a healthier, younger state. For example, when we go out in the sun, your body will make more vitamin D because there is a chemical reaction that occurs on your skin. So this technology is what is referred to as light therapy or phototherapy. And many health practitioners use light therapy today in many ways, in many forms. And so X39 is actually worn for 12 hours during the day and off for 12 hours during the night, because at night is when we rest and repair. And then you reapply a new patch each day. And you can wear the patch on one of the 2 recommended locations on the back of the neck, C7, which is my favorite, or just below the belly button, or actually you can wear it anywhere on your body. Those 2 locations, though, are used in clinical studies and have shown to be really beneficial. Some of the benefits from X39 include pain and inflammation reduction, better sleep, more mental clarity and energy, softer skin, even hair growth, and wound healing. A lot of studies in wound healing and faster recovery from injury, and also recovery from workouts, and of course, reverse cellular aging. So the X39 is what I say works at the root cause and is the foundation for good health and the place to start for everyone. And then you can add the other patches as needed. So then the Eon, of course, is a perfect match to add next, as it accelerates the reduction of inflammation and stress in the body. And as we know, so many people are going through stress, which causes anxiety, which leads to depression. So Eon is a wonderful at balancing and calming the brain. It reduces cortisol and reduces CRP. It also elevates DHEA and it balances the nervous system. It boosts collagen throughout the body. It also induces antioxidant activity in the cells and is really, it's referred to as a happy patch. So it's great to use along with the X39.
And I've been taking what is the component in the Eon Patch SOD every single day since 1994 when I was diagnosed with PTSD, and that was one of the solutions. And I can tell you that because of that, I was able to feel the X39 right away, like the second day. Why? Because I didn't have inflammation in my body, because that's the thing that stops stem cells from being alive and thriving, etc. That's why using the Eon during a 24-hour period, along with the X39, is so important, because I've seen it with my own body. I've seen it with my own experience. It's really, really huge. So thank you, Rhonda, for the description, which is so important. I mean, it's great to put the patches on, and it's so much better if we understand what they're doing for us. So the next example, your next patient, we're going to talk about hormone issues and how this completely shifted your patient's life.
Yeah, so that was Betty. Yeah, she is a recent female patient of mine, and she's 55 years old and was going through, is going through the change and having all the typical issues like poor sleep, mood swings, hot flashes, foggy brain, and weight gain. And she wanted to try something natural to deal with it and came to me for some recommendations. So we worked on some dietary changes and started her on the X39 during the day on the back of the neck, C7, Eon during the day under the belly button, And then aloe vera at night on the middle of the forehead to regulate hormones and help with sleep. And then SP6 on the inside of the left ankle during the day for cravings, also balancing the brain and balancing the hormones. And just after 2 weeks, she was feeling better. And now it's been 2 months. Her moods are better. Hot flashes are about half of what they used to be. And the foggy brain is clearing up. And if she continues to be consistent, you know, a lot of those remaining symptoms should clear up.
And, you know, you talked about something really important, which is when you said the left ankle.
Yes, that's just one of the areas that you can put it.
Exactly. But please notice that some of the patches have a polarity. So it's really important that when they talk about the nirvana, which Dr. Rhonda is going to describe in a minute, and she talks about the position near the underarm, it's the right underarm. When you look at the diagrams in the back of these little brochures, it took me months to wake up to the reality that they were talking about the SP6 that balances out blood sugar and eliminates cravings needed to be on the left side of the body. It just didn't compute with me. It didn't occur to me. So I want to make sure everybody understands that, because now I've been completely free of sugar cravings for more than a year. And it would have happened a lot sooner if I had really understood what I was looking at the back of the brochure. So when you talk to your friends, when you talk to your family, when you tell them about Lifewave and when they purchase Lifewave, I really encourage everyone to go over the little illustrations, at least one or two of them, and say, now the C7, the back of the neck, that's a center point. Below the belly button, that's a center point. But there are others where you have to be aware of which side of the body is best, right? Okay. So if you would, Dr. Rhonda, please describe the Nirvana patch.
Okay, so the Nirvana system comes with a patch and a supplement pill, and you can use them separately or together. Nirvana is the patch that helps you attain the state of happiness and joy, and it actually lifts depression, and it elevates and sustains the production of beta endorphins. And then the pills contain seaweed extract, which is one of the best sources of iodine, which helps support your thyroid gland. Seaweed is full of vitamins and antioxidants that actually help protect your cells from damage. And seaweed also helps with blood sugar management.
See, I knew that I was going to learn a lot of things today that I didn't know before. So that's one I didn't know. And I wanted to make sure many of you understand about the potential of repositioning the Eon and the X39 if you need to. For example, sometimes I wake up in the middle of the night, my neck has been in the wrong position, I have a pain or an ache in my neck or shoulder, I'm half asleep, I sleep with the Eon on, I take it off, and I put it on that part of my body that aches. Literally 5, 10, 15 minutes later, I'm sound asleep. I wake up, no discomfort. Same thing with the X39. I suddenly got acid reflux. I had had some citrus juice yesterday, and suddenly that wasn't any fun. So that was a daytime hour. I had the X39 on. I positioned the X39 to right where I felt it in my chest. Literally 5 minutes later, no discomfort. I type all the time, carpal tunnel. Last week, I really was in pain. I put one Eon on. That made it less, but it wasn't gone. I went and got another Eon. Many of you know I have these 11 pain relief protocols in a document. You just have to email me for them. So I took another Eon. I put it right next to the first one on my wrist, kissing but not overlapping. And now 15 minutes later, my wrist was perfectly fine. How many of these things do people endure in a lifetime? And we don't have to anymore. And you know, if I hadn't addressed the carpal tunnel pull then, what's the odds that the next day, the next day, the next day, the next day, it gets worse and worse, right? You've all been there with something. The way that people get chronic pain is because they didn't know how to eliminate the problem when it first occurred. So that's why I've got these 11 pain relief protocols for you. Okay. So Dr. Rhonda, if you would talk about Wendy, who's another one of your patients who suffered with depression, please.
Yes. So Wendy was not only having depression and anxiety symptoms, but also she was very tired, was gaining a lot of weight, and she was on thyroid medication as well. So we started her on the X39 on the back of the neck, C7, Eon just below the belly button, and Nirvana at mid-chest heart level, and in addition, this Nirvana pills because of the benefits for the thyroid, right? So 3 months later, she has, more energy, she's happier, sleeping better, less sugar cravings, and has stopped gaining weight and is actually maintaining her weight now. And now we're going to be moving into some other patches to help her with her weight loss soon. So as you might see, I like to work with a few health issues at a time, eventually getting the body balanced gradually. I don't like to do too much too soon. It's kind of like peeling an onion one layer at a time. So the body has time to find its new normal. And the patches work gently with the body. They reorganize and rebalance the body systems. And we always want to work at your body's pace.
And perhaps today you would tell all of us who are watching and all the thousands of people who will be watching this on my YouTube channel over time, what are all the patches that you might give someone who has a serious commitment to losing weight and getting healthy? What are all of them?
Yeah, I would use, of course, X39, the SP6 for cravings, and also X49, which is studies have shown that the participants lost an average of 11% in 60 days of body fat. So that's a good one to add as well. Those are the three main ones that I work with for weight loss. Yeah.
Thank you. And I found it very interesting about the X49 because I had moved the X49 from below my belly button to the position below the right knee and off to the side, because that's the one that's supposed to have the biggest effect blocking electromagnetic frequencies. Mm-hmm. And that was on my mind. However, my stomach wasn't flat anymore. So I said, okay, that's not a trade-off that's okay with me. So I don't need to get rid of 11% of the body fat on my leg. I need to get rid of it, where it's visible in my clothes. So I'm telling you this, everybody, because I moved it back a week ago and I appear thinner. There's no question that my clothes fit well now, and they were starting not to. So it's really fascinating to me. 11% of body fat elimination. That's a huge number, a huge, huge number. Anybody, no matter how thin you may look, we have to remember that it's the fat around the organs that is a big aspect of this. Dr. Rhonda, if there's something you'd like to say, even if people think they're thin, the organs may not be so thin.
Right. Yeah. The other patch that I also recommend for weight loss is the energy patch. The energy patch, actually, when you wear it, you are burning about 300 calories each day that you wear them. So without even exercising. So if you exercise as well, you're going to have higher amount of body fat loss. But always remember to keep hydrated when you're wearing any of these patches, and especially if you want to lose weight, you've got to keep hydrated.
And now the next example that Dr. Rhonda is going to give us is one that inspired me just yesterday, because Dr. Rhonda and I were talking and preparing for the show. And so we're going to talk about your husband's skin. Okay.
Yes. Okay. So a few months ago, my husband's he's out in the sun a lot and he wears short sleeves. And we recently moved to Prescott, which it's higher intensity sun. And he started getting these a couple growths on his arm that looked pretty serious. And we don't have a dermatologist up here and we couldn't get to one. So I thought, let's try the patches, because I've been using the patches for different things on my skin, whether I cut myself or burn myself. In fact, I have one on my hand right now because I burned myself putting my hand in the oven, pulling something out of the oven. So I thought, let's try the patches. And so I started putting the X39 on during the day. And at night, I put the Alavita, and I just alternate like that. And within a couple weeks, every time you take off those patches, when you have like a scab or a burn or something, every time you take it off, it takes like a little layer off. You see it on the patch. It's amazing, right? And the skin just kept getting flatter and better and better. And after 2 weeks, it was almost completely gone. And then another couple of weeks, we kept doing it. And I mean, now he has no scar there. It's amazing. So those two together work really well for any type of skin growths or skin tags, burns, cuts, things like that.
That is really, really huge. I mean, that is huge. And I have to say that after you told me that, Dr. Rhonda, I did it just once so far, because we just spoke, and I saw a difference after 12 hours.
Yeah.
So one patch later, I saw a big difference on my leg. And I swim all the time, and it's very sunny in Santa Barbara, and I'm not going to put suntan lotion on every inch of my body. So that's the cause, and looks like this is the solution, which is really, really thrilling. Because as we get older, the accumulation of sun, and anybody who's around my age, we used to sit out in the sun. We didn't understand how dangerous it was. So this is a commonality. Okay. So maybe you have some more examples, Dr. Rhonda, since we have a little bit more time. We have like 11 more minutes that I don't want to let you go. I know you've got more stories.
Well, I could tell you some of my own stories. So when I first started, I was researching the stem cell industry, and I knew that the stem cell industry was the future of medicine, and I wanted to get involved somehow, but back then, it was about 4 or 5 years ago, and it was the injections, it was costly. You had to be an MD to do that, and then it wasn't legal everywhere. So, there's still ongoing research going on. But then along came the patches, and I saw those, and I thought, wow, if these could really work, this could be amazing. But I have to try things before I recommend them to anyone. They have to work for me. I have to believe in them. And so I started wearing them, and within a few days, I noticed more mental clarity, more energy. And that was good. But what really sold me was on day 5, I had a hip pain about 4.5 months prior to finding the patches. I tried everything: chiropractic, acupuncture, massage, stretching, nothing worked. And on day 5, my hip pain went away and has not come back. And this was just with the X39 on the back of my neck. And that's what really told me that it was doing something in my body. This was working. And so I started sharing it with different people, different clients, and have had great results with, like I have talked about today: depression, mental clarity, inflammation, pain, low back pain, carpal tunnel, things like that. And then what happened was, so when you wear it longer, more things happen in the body. So after 7 months, my hair stopped falling out. Now, my hair had been falling out for a couple years. I was going bald, and it was awful. I'd brush my hair and there'd be full of hair, and it was awful. So after 7 months, I brushed my hair and there was no hair in the brush, and it just stopped falling out. You know, every once in a while I'll have a hair or two, but now it's like my hair's growing back, it's thicker, it's growing faster. And that was after 7 months. And then after a year, I noticed that I had double bunion surgery about 10 years ago on both of my toes. And so I was left with one numb toe. And so it just was numb all these years. And after about a year, I noticed my toe wasn't numb anymore. And all I was wearing was the X39, right? So those are some of the things that have happened to me. My eye floaters are gone. I used to get eye floaters all the time. And it was really awful because I would think there was a bug, you know. I don't know, for people out there that have had floaters, it's like you think a bug is flying in your face. But so those are gone. And so I've just really enjoyed sharing these patches with people and seeing the benefits they're having over the last 3 years. You know, it's very rewarding to me to be able to help thousands of people now. Instead of just one-on-one in my office, I can only see so many people, right? So I'm able to help a lot of people, and we have so many testimonials, thousands of testimonials with real people. And so the patch works, all of the patches work, and the X39 is, you know, of course, my favorite because it does the most in the body. And now X49 is pretty amazing as well. That just came out about a year and a half ago. So,
and, yeah. You know, one of the points you make, which is so important, is that you can help people. And I have an entire group of people based in Hong Kong who I've never met. And they all came from a woman who found me online, who lives in France, who I've never met and is now my closest friend, really. One of the top 3 for sure. We speak all the time. And her life has completely changed because of the patches. And little by little, all of her friends in Hong Kong, which is where she's from, their lives are changing because of the patches. So the social aspect, the making a difference in the world aspect, the watching people you care about and love, knowing that they're going to be healthier over time, not the opposite. It's just such a joy on every level, you know, Rhonda?
Yes, it is. And, you know, I talked to a lot of other health practitioners, and I'm sure there's some on the call today that, you know, it's something that you can share with your clients and help so many different issues that are going on with them. It's not just one thing specific. And so you can give better care to your patients by using these patches and helping the body reorganize and rebalance and repair. I mean, there's no other way like it that I have seen. And it's just a really good way to share with your clients and help a lot of people at once. So if there's any practitioners on this call, really take a good look at this. The science is there. It works. Try it yourself. Try it with a few people. You can call me if you have any questions. And let's, you know, help as many people as we can, right? That's what we're here for. Exactly.
Help millions, and the entire body benefits. And one of the big thrills in the last couple of weeks for me has been understanding that 6 months after we begin using the X39 and the Eon every single day for 12 hours a day, our cardiovascular system is literally proven to be 8 years younger.
Yes.
Now, this is astounding. There's nothing else like this, because remember that even people who were getting stem cell injections, those didn't always work. And Dr. Harmon has been on my show twice or maybe 3 times now. And there was a doctor in his office that used to use the stem cell injections, except they didn't always work. And the price was thousands of dollars. Dr. Patty de Blasio was on my show. She said the same thing, that this was an unbelievable alternative, that you can just take a patch that almost anyone can afford and slap it on your body and forget about it and remember to take it off 12 hours later. And little by little, day after day, weeks, months, years later, you have a different life. I have a different life. Thanks to you, Dr. Rhonda. No kidding. A different life. From the 3rd day, I knew that this was a true miracle. I had prayed for a miracle. How many of us have been in that place, right? Where's it going to come from? I don't know, but please, it better come, and it better come now. And when you talk, Dr. Rhonda, about having a pain, an injury that would not respond, did not respond. Many of you have heard me say that I swim all the time, many, many, many laps. I pulled my shoulder muscle. I spend so much money and so much time on all the alternative care that I'd ever used in my life, and it didn't go away. And then I said, wait, I've got a drawer full of patches. I've got the Telegram app with thousands of people's testimonials. I am not getting up from my chair until I solve this. I went and I got all the patches, brought them in the living room, sat them on the coffee table, scrolled through the testimonials on the Telegram app. I found the kissing technique, 2 eons with the edges touching, not overlapping, slapped one on my shoulder muscle. Better, not perfect. No, I said perfect is what I'm looking for. Better's not good enough. Okay. I took another one and I moved around and I stuck it on. 10 minutes later, my shoulder was healed. And just as Dr. Rhonda said, the pain never returned because the injury was healed. My pain never returned. The injury was healed. How many people do each of us know who has a chronic pain, which is always caused by inflammation, and we've got the solution? Right, Dr. Rhonda?
That's right. That's right. Yes.
So thank you, everyone, for being on our show today. And thank you, Dr. Rhonda Donahue, who started all of this joy, bliss, healing, health, ease, comfort, and I got to say, hopefulness. When you don't have to be scared about the future of your brain and your body. Doesn't that make you feel the way I do? Is like, oh my gosh, hope, you know? So thank you, Dr. Rhonda Donahue. And this show will be posted in about 10 days, maybe sooner. So please subscribe to the channel if you can, so that you're always informed when we have a new show. If you want the transcription from Dr. Rhonda Donahue, send me an email. If you want the 11 pain relief protocols, again, just ask me that. My email is susan@susanallan.org, and that's ALLAN. And I will see you on December 8th. It's always the second Thursday of the month. It's always 1 p.m. Pacific, 4 p.m. Eastern, and various times. And our beloved Marcy Preble will be back. We will see you then. And thank you so, so much.